Good afternoon, this is Dr. Do again. Today's video is an alphabetical list of the conditions. We're on the under the B list. Today's video is going to be on benign versus malignant. What kind of situation, what kind of condition you need to see emergency? Of course, it's malignant. But a lot of time, malignant is not an acute process. It's a subtle, long-term, at least couple of months, or 6 months or 3 months to grow or to make change. So the malignant itself does not warrant an emergency visit. However, some of the malignant problem can cause acute, life-threatening conditions. If that's the case, you need to see the emergency. For example, the lung cancer, you do not know, and then the cancer is probably at the center near the trachea or bronchi, and one day suddenly it grow in size, enlarged to compress the trachea or bronchial, or there's a tumor around the chest. So that's also, you do not know, no symptoms, and suddenly grow fast and compress the trachea or bronchi. That's the case. Or like previously I said, lymph node growing suddenly. It was there, probably you did not realize, or you did not pay attention, or it doesn't bother you, so you did not seek medical attention for some reason, and suddenly grow very fast, compress the trachea. So this is one of the emergency. The other cancer or malignant or emergency is the tumor in the brain. Of course, you did not know, suddenly caused the local or focal nerve deficit. So that's the emergency. You need to see your a physician to check it out, to emergency, or the physician to check it out. Other than that, I couldn't think of the complications of malignancy. Of course, for example, liver cancer can complicated by the varicosis of the esophagus. Last time we talked about it, can cause the profound vomiting of blood, or the lung cancer itself invade the blood vessel, can suddenly cause the hemoptysis, means coughing up blood. So these are the emergency situation. You need to see your physician. Emergency, probably you know it or you do not know you have malignancy, but these are just the common sense of life-threatening situation. You need to see the emergency. Okay, generally speaking, benign versus malignant. What is the difference? In the common word, non-medical word, benign means good, not bad. Malignant means very bad. In medical term, histology or pathology terminology, benign usually refers to the tumor or the growth. It's have the normal morphology, okay, not undergoing the malignant change, okay, not transform into totally unfunctional cells. The cell looks regular. The basement membrane, for example, if in the skin, the basement membrane, also there's some fibrotic tissue wrap it around to make it feel smooth. So this is the benign. There's a definition in terms of pathology under microscope. Benign versus malignant, you only diagnosed under the microscope, by the way. So the malignant, which is a cancerous change, what does that mean? It means the cells lost the normal behavior function, lost the function, normal behavior. For example, the epithelial cells or on the skin, the cells different layers, okay, stratified squamous cells, and the basal cells can grow and reproduce and regrow, and the top of the cells just loss or lose or just wash off. It's just common word, not the medical word, not the terminology, but this is the explanation However, if it is a squamous cell carcinoma, for example, you cannot tell the cell morphology, the shape, and in terms of the nucleus and the cytoplasma, all changed. It's just the chaotic, disformed cells, of course, lost the normal function. So this is the benign versus the malignant, the explanation in terms of medical standpoint. What's the difference, how to diagnose it? Clinical or the manifestations, such as you can sense it. For example, if you have a growth on the skin, can you tell is malignant or benign? Majority of case you can. Last time when we talked about the lymph node, I talked about what kind of lymph node is warrant a medical attention, because the either lymph nodes or any growth under the skin, for example, you can feel it. It is hard in terms of the nature of the tumor, not soft, not loss of flexibility. It's very hard and irregular. You can feel it. It's not like a smooth and round or oval shaped. No, it's just irregular and hard. And in terms of mobile, whether it can movable or not movable. If the benign tumor, usually, like for example the fibroma, it's very round, smooth, and you can move it from place to place. If you put your finger there to press it, to palpate, it's just move different places. It's called. But usually, if it's malignant, it's just hard, attached to the under of skin, under tissue, or the surrounding tissues. So it's unmovable. If you touch it, it's fixed, it's hard, it's irregular. Usually not painful. So if that's the case, that really is not a good sign. Very likely it's a malignant. For example, lymph node, I talked last time, either subclavicle or superior clavicle, or under your chin or in the armpit. So if you have, we all have lymph nodes. Usually they're less than 1 centimeter, more like mobile. You can just move it around. And so that's normal. And the other sign for malignant compared to the benign is you have something grow, for example, growing under the skin, and suddenly change the behavior from used to be very round, mobile, smooth, suddenly becomes enlarged very quickly in short time, and becomes fixed, irregular shaped. Things like this, like the melanoma I talk, what kind of the sign from the benign, just a spot there becomes a malignant change, like the color becomes darker, the border is not regular, and also may have bleeding or some hair grows on it. If this is the case for the melanoma, you need to, for the regular change, from regular change to malignant. So these are the signs. These are very surface touching, fundamental. You probably already know it, but just in case for those who did not know it or did not pay attention to it, now it's time. I hope this video will help you to think about it and just pay attention to yourself and keep healthy. Thank you for your watching, and I will see you next time.